we're going to keep it brief. We're going to keep it focused. In fact, our goal is to be able to get through this in less than 30 minutes. But then we will gladly stay on the line to answer any questions that people might have. Also want to let everybody know that we are recording this. So afterwards, if you'd like a copy of the recording, either for yourself or to share with colleagues who couldn't attend today, we'll be happy to provide that. But again, thanks everybody, and we're going to go ahead and dive in. And I'm going to just set things up and give a little bit of context, and then we're actually going to demo Channel-19. And Channel-19 is actually intended to be a standalone COVID-19 employee health monitoring application. It is really designed to help organizations monitor their employee populations during the coronavirus pandemic. And the idea is to actually help organizations document and respond to things like employee symptoms, test results, possible exposure to COVID-19, and also identifying underlying conditions that could lead to adverse outcomes for certain individuals in your employee populations. We also think it's going to be important to have something like this in place down the road when restrictions begin to lift and employees are able to return to work, at least those who are kind of working at home today. So Channel-19 will be able to help you determine and manage a return to work order operations because we doubt that you're going to want to have everybody come back en masse. You're going to want to be strategic about bringing people back based on their risk profiles and immunity and those sorts of things. As we've been working on adding COVID-19 functionality to our existing platform over the past 45 to 60 days or so, we've talked to a number of employers who are trying to manage all of this on paper or on spreadsheets or by trying to make do with other applications that really haven't been built for this purpose. So, you know, we know that there is certainly a need out there. Just to give you a little quick background on our organization, and I know some of our clients are on the line today, but for those of you who are not, you know, we work with a number of large organizations, and we provide occupational and employee health software to health systems, to government agencies, to some of the largest corporations in the world, most of whom actually operate their own on-site employee health clinics. And this is, you know, just a smattering of some of the groups that we work with. And our platform already has embedded in it extremely rich functionality, and that includes pandemic response workflows. But over the last 45 days or so, we've been collaborating really closely with a number of our clients to modify, deploy, and refine already existing capability specifically around COVID-19. As you might imagine, during that period of time, we've learned a great deal. We've made a number of adjustments to the functionality based on real-world application, and we're going to continue to do so as this pandemic unfolds, as more data comes in. We're going to continue to tweak and refine the application, not only for our clients, but also for anybody who elects to use this Channel-19 application. And really, now that we've got some real-world data and some real-world use, we've realized that we can take the COVID-19 monitoring capability that we've bought and make that available as a standalone offering for any organization that can use it. And this applies whether or not you operate your own on-site clinics or whether or not you have medical personnel on staff. We know in many cases, this is something that either the HR department or environmental health and safety personnel are trying to oversee and manage. So we've set this up so that it could be used by clinical personnel or really anybody who is trying to administer the monitoring of employee populations. So with that as background, I am going to turn control here over to Angela Hunsberger. And Angela is one of our deployment consultants. And Angela is going to give you a brief demo of the application and its capabilities.
Thank you, Jeff, and thank you for pronouncing my last name so perfectly. So I'm Angela Hunsberger. I'm one of the deployment consultants. I'm going to walk you through the monitoring application, and I'm going to start first with an employee self-reporting, and you may choose or may not to choose this portion of the workflow, but I would like to show it anyways, depending upon what your organization is going to decide. So I'm going to start here. So this is an email that can be automatically sent to employees, prompting them to go to an employee portal to complete a monitoring questionnaire. The frequency of how often this email is sent, as well as the email content, is completely configurable. Only the employees who have been added to a medical surveillance panel will receive the email to fill out the questionnaire. And the surveillance panel membership designates who is monitored, and it can also be configured. You can have employees be added to this individually or added in groups automatically from an HR import. You can use business rules based on job code or department or other criteria. So this portion of the workflow would be the employee gets an email, and there's a link right inside the email to go directly to the employee portal. And when they click on the link, I'm going to drag this over here. I'm going to put on my employee hat here. When they click on the link, it goes through single sign-on directly to this symptom monitoring questionnaire. Some of the fields will be pre-populated based on my previous answers. This questionnaire can be completely customized too, depending on what information you would like to collect. I'm going to go ahead and answer some of the questions here that I'm symptomatic. And what's going to happen when I click submit on this questionnaire is there's a COVID response team that's going to get an email that an employee reported symptoms. So when I click submit, what will happen is this email will be sent. So I have Christine, Harris, Emily, Daisy, and Angela. We're all on the COVID response team in this scenario. And it has a link to the questionnaire that the employee reported along with a summary of some of the information. And what I can do is I can click on this link and go directly into the application to read the questionnaire and document. Now I'm going to go right into the application right here. So if you choose to use that symptom monitoring questionnaire, that's definitely part of it. It's already built and ready for you to use. Some other clinics decided, we're not going to use the symptom monitoring questionnaire. We're just going to manage the population right within the application, and that's okay. You can do it both ways. So when I first come into the application, I'm taken to this landing page, and it's very simple. I have a couple of side menu items here. This COVID-19 is my landing page, and when I come here, I have these are called portlets. So I can search for an employee. I can see my COVID monitoring work list. These are the employees that I'm monitoring right now. And I also have my recent charts. This is just a quick way to hop right back in to a chart that I was in. Looking at this COVID monitoring work list, I can see my employee's name, phone number, their supervisor name, and contact information. I'm going to scroll over to the right here. If I'm doing the self-reporting questionnaire, I can see the last time they self-reported. If they've been placed out of work, I can see their last work day. If they were referred for testing and what the test result was. Also, if there were any restrictions, like lost time. To jump right into the employee record, I can click on their name. And this will bring me to a little summary screen within their record. I have a snapshot of these demographics. And again, these are little portlets that you see here. I have medical history I can see, their last vital signs. I can see any allergies or current medications. To hop right into my documentation, this is where instead of doing it on a spreadsheet like many people were doing before, and it's grown so quickly and rapidly, the volume has become almost unmanageable. So this has been such a relief for a lot of our clients. So instead of doing the spreadsheet, You can hop right into the encounter. And this encounter is organized into little sections, and I can hop around using these blue buttons. Just a few things I want to point out here. I can see a case manager, so this would be the person who's kind of following this employee if you want to use that and assign somebody here. I can go to my plan narrative, and think of this, if you are currently tracking some things on a spreadsheet, this is kind of where you can visualize that. So if I'm tracking a monitoring reason, maybe an approximate exposure date, when symptoms started, if I decide to refer, this employee for testing or not, if the test is pending, positive, negative, and then also you can track out, we're also working on some reoccurrences. So if they've had it, already, they were tested positive and then they came in again and tested positive. So these fields here, if you're currently tracking them on a spreadsheet, this can be modified and matched to the discrete data that you would like to report. Next, so let's say, I'm interviewing this patient, I'm going through and answering these questions. I can put in some notes here. So say I'm going to follow up on Tuesday, and I'm also going to say, I can put in as many notes as I need as I'm following this patient, so I have a record, or this employee, so I have a record. So with PCP, will place out of work pending test results. So I can put a note there. I can add a, if I'm tracking my lost time, this is really nice here. I can put them out of work pending my test results, or if they were calling back, or if I was talking to them and we did need to place them out of work, I can put a restriction here. And what will happen is the supervisor will automatically get an email that this employee was placed out of work. So I can do that here. I can put my encounter on hold and kind of follow this patient or this employee through. They will stay on my work list. Like, let's say as a provider, maybe I was out of the office. Anybody can come in here and pick up where I left off using this work list. I can also, if this list is very long, as you can imagine some of them are, I can even filter just for mine. So I'm Christine Harris, so if I just want to filter for mine, I can just see mine, or I can toggle back and forth. So there's a lot of ways for me to make this list manageable for me to easily use. Now, the last thing I want to show you is actually pretty cool. It's the statistics, the statistical dashboard reporting that we have in here as well. And these reports are fed through that information that I entered during that encounter. So think of the criteria, that you're currently tracking in your spreadsheet that you might want to track in this application as well. I mean, out of the box, this is what we have. But again, a lot of it can be customized to fit your needs. I'm showing you some of the lost time. I can see lost time, number of days by department, and there's different volumes and things we can track just right out of the box. The testing outcomes like I have here. So in a nutshell, I walked you through an employee self-reporting. I walked you through documenting the criteria, the interview questions that you're probably asking the employees now, if you're referring them for testing or not, any of the follow-up. Let's say the test result came back, you can come right and hop right back into that visit. You can enter the result and you can remove that and start the return to work process from there and even track the outcomes. So Jeff, I'll hand it back over to you.
And thank you very much, Angela. Great overview. And I do want to emphasize too that as Angela pointed out, this has been built to be very standard, right out of the box, very powerful. But it's also built to be able to be configured specifically for your workflow and your unique needs. So let's talk just a little bit about contracting and deployment for this. From the contracting point of view, we know that, certainly time is of the essence here. So we've made this very, very easy to acquire. And we've put together a very simple couple of pages proposal that outlines kind of the scope and the costs. And we want to be very upfront and transparent with everybody about this. There is a one-time upfront cost for deployment, and that covers setup, configuration, deployment, training, and go live support. So that's just a standard, one-time fee, and really should kind of cover the needs for just about anybody. And then there's monthly licensing, and that is based on the number of administrative users, and we'll talk about that in just a moment. We've also put together a very simple contract that's just a couple pages long. Again, a short and simple agreement, because we know we can't afford months and months of back and forth on contracting, because hopefully by then this thing will have subsided. So again, we recognize that we need to be able to move very quickly. From a licensing point of view, the licensing costs, again, very simple and straightforward. It is based on the number of users, and that's defined as administrative or clinical users, the people who are actually conducting or managing COVID-19 employee monitoring. So for example, if you had 14 users, you would pay $650 a month, and all 14 of those users then would be able to use this. So you can see it's tiered, based on the number of users. There are no additional licensing fees based on the number of employees or locations or other factors. Again, we've tried to make this very affordable and very, very simple. And you can terminate at any time with 30 days notice. So there is no long-term commitment. Frankly, we're hoping that people only have to use this for a few months, and this thing will have moved past this, and people will be able to stop using the application. And really, our goal here is to cover our costs, kind of keep our people focused on helping our clients and helping other employers who can benefit from this. If you are an existing enterprise health client, there's actually a different approach here with no additional, licensing costs, on top of what you're already doing. But this is for new folks who are just going to use Channel-19 as a standalone application. In terms of deployment, again, we've set it up so that this thing can be set up and installed very, very quickly. And the way that would work is, if you're interested and you want to move forward, our folks will demo the product, kind of walk through the review. We'll work collaboratively with your organization to make configuration decisions and get this thing set up. And the idea is that, we want to make this, extremely simple. Should not take a lot of time for your people, to work with us to get it configured. Training, we believe we'll be able to train the users on this in probably 60 to 90 minutes at the most. So it's a really simple and straightforward approach. From a technical point of view, there are only a couple of things that we need to look at. One is, if you're going to use, for example, the employee portal, ideally you're going to do that through single sign-on, and that's just kind of an added security measure. So setting that up, again, not a very difficult thing to do. We set up single sign-on all of the time. We've got a very straightforward process for that. We would just need to work with someone in your IT organization, who's responsible for that. It will not be a big time demand for them. And then also, ideally, we would be able to do a one-time HR system data import. And I know we had one of the questions that came through on our chat was a question about, how would we actually load people into the system, get their demographics and email addresses and all those sorts of things. And ideally, the best way to do that is to set up this import from your HR system. Again, we'll have a specified number of fields and a format. We can work with your IT folks on that. And again, it's not something it's not like setting up a real-time ongoing HR interface, but kind of a very simple one-time project. And then, as far as training and support, that can be done remotely via WebEx, and then provide go-live support. As people start to use the application, there are generally questions, and we may need to make some quick refinements once you put it in your real-world workflows. From kickoff to being live and ready, it's something that, shouldn't take more than a week or two. And a lot of that, too, we know that everybody is extremely busy, so, we'll be very mindful of that as well. Again, we can move as quickly as you would like to move. I'll also point out that this is a web-based software as a service application. So, you don't have to install something on your network. Again, doesn't take a lot of time from an IT perspective. We host this in a secure, HIPAA-compliant environment. So this is, definitely medical grade. A lot of focus in our organization around security and privacy protection. Data is encrypted both in transit and at rest. And then we have a number of third-party certifications, SOC 2 Type 2, High Trust, NIST Cybersecurity Framework certification. So again, this is all going in a very robust and secure environment. And then we've prepared a security documentation package, and that gives an overview of our hosting and security, a copy of our information security policies, our most recent SOC 2 Type 2 certification report, along with a High Trust certification letter. And we can share this documentation with anybody after you've either executed the contract for this, or in the interim, we can put a confidentiality agreement in place. But of course, because this is very confidential data, we've got to have some sort of an NDA in place in order to move forward. But the aim here is to be able to give your IT and security people a very comprehensive, complete package. It'll give them a really good understanding of our security and privacy protection practices. And again, be able to streamline that procurement process so that this can get up and live very quickly. So in summary, the concept here is we want to be able to help you monitor your employees both today and then as we begin to see widespread return to work, which again is going to have to be managed very carefully in order to protect operational integrity and avoid, reigniting another outbreak. This application is designed to reduce replace spreadsheets and makeshift solutions and really streamline employee monitoring. We've made it very quick and easy and affordable to both procure and deploy, and there's no long-term commitment. You can terminate your agreement anytime you want. And important to note, as we continue to work with our clients, we're going to continue to refine and enhance Channel-19. A great example of that, we're going to be rolling out a telehealth option in the next week or so, and that will be part of Channel-19 that will actually enable users to conduct video encounters with employees right from the application. There won't be any additional software for employees to download, and that will be an add-on option that we're going to make available for people who are interested in that. It's something that we're already rolling out, to our enterprise health clients who are using it in their clinics, and we're going to make that available as a Channel-19 option, probably starting next week as well. And we'll continue to iterate and to refine and to make improvements, and as we do so, we'll make those things available, to everybody as this whole thing evolves. So, if you're interested, we will be following up afterwards. We're going to send out an email to everybody who attended with a copy of the proposal, and that will come from our sales team. So you can certainly respond to them, and we'll be doing outreach here, over the next few days. Also, if you're really in a hurry, you can respond we set up an email called channel19@enterprisehealth.com. So if you shoot an email there, we'll get back to you very, very quickly. Also today, I want to thank a couple of our partners, IHPM, the Institute for Health and Productivity Management, and Verdantix. They helped us spread the word and kind of let people know about this. So with that, I'm also, real quick, I'm going to go through the questions that were posed from chats. One of those was, how is it populated with staff and demographics like email addresses, supervisor, location of work, etc.? And again, that would be done through that HR import, and that can be done, as a one-time import. We certainly, if you're interested, we could set up a real-time interface, or we could refresh that import. So that's certainly an option. So another question is, can employees information from a mobile phone We are working on that. That is an option. I know that some of our clients from a security point of view would not be comfortable with that, but that's certainly something we can make. Another question that we got is that the number of users changes daily from 30 to 100 at our hospital. How would that work? And again, you know, if you've got a situation like that, then we'll work with you. We'll get creative. Again, this is a very fluid, dynamic situation, and we're trying not to be overly rigid. So, you know, if we've got someone who's interested but has that sort of a situation, you know, I'm certain we can come up with a licensing approach that will be fair and equitable. Another question: if it's a one-time HR feed, how is the program staffing updated as people are hired and leave? And again, that can be a one-time feed, but it could also be refreshed. And again, what we're trying to do is avoid having to set up a full HR interface. We can certainly do that, but we could also set it up so that maybe that HR feed is refreshed on a weekly basis or whatever frequency is appropriate. And the goal is to make it a simple, you know, your HR system spits out an extract, and then we're able to upload that using an API that we have developed. So again, it should not be a problem. So here's somebody who's already said they're interested and want us to send the security documentation so they can share it with their crisis team. Again, happy to do that. All we need to do is put an NDA in place. So we'll reach out to you, Orlando, and you know, get that taken care of, and then we can get you that documentation right away. Another question is there any way to print or export a single encounter, for example, to insert into a medical record? And yeah, the answer to that is yes. You know, we can certainly print or export an encounter so that you could put it into you know, either a paper chart, or it could be uploaded into another electronic medical record system. Another question was, will a recording of the presentation be available? And the answer is yes. We are recording this session, and we will send out a link to the recording to everybody who attended. Right now, it takes WebEx a couple of hours at least to render a recording, just based on, again, the volume that they're seeing. But we'll get that out to you either this afternoon or first thing Monday morning. Another question was, can staff upload documents such as their test results? And I believe, and Emily, please correct me if I'm wrong, but the answer to that is yes. We can enable you to be able to use that employee portal where you saw the questionnaires. That can also be set up so that you could upload documents like test results or other things.
Yeah, exactly. So if one of your employees was maybe tested through their primary care provider or through another means, if you were not the folks who ordered that and there's no like lab integration, they can actually just even snap a picture of the results if they have them from their cell phone, or if they've gotten them over, you know, maybe like an Epic portal or something like that, and it's in a PDF form, they can upload that right to the portal really easily. Okay,
great. Hey, Emily, here's another question that I think you could answer. It says, can you aggregate data across different hospitals that are in the same system?
Oh, absolutely. Yeah, the system is actually quite scalable to manage multiple business units or even to manage multiple standalone organizations. So if you're, you know, an employer with a single business unit, it works great. But if you need to scale up to a global operation that has, you know, multiple business units, or just a regional operation like in a healthcare system where you have several hospitals that you're helping to manage, it scales beautifully to that. There are actually ways that you build in those organizations' profiles. It's real quick, just a couple of clicks, and then you can assign the employees that you're monitoring to those different organizations so that you can get the statistics that Angela showed broken down by the organization that they work for.
Another question is there lab integration with Quest or LabCorp? And the answer to that is yes. Routinely work with both Quest and LabCorp, as well as a number of other labs. And, you know, that's there's some extra cost associated with that, but that's something that we do routinely. So, for example, if out of this application you referred someone for testing, we could set it up so that you could actually, generate an electronic order from Channel-19, and then you could receive the results back electronically. Another question, Emily, this is probably for you. Is there an automatic denominator so I could see the % of RNs out sick, maybe even by location, for example?
Yep. You can track the time that they are away. You'll actually plug in the start and end dates. And in one of the graphs that Angela showed, it'll actually show you by department how many people are out. You can switch that with a click of a button, though, from department to job role. Oh gosh, there are several facility where they're working, like physical work location rather than just a department within that facility. So there's a lot of good hierarchy there that you can break that down, and it will show you the days away, what group they fall under.
I want to add to that too. Those graphical charts that I showed, you can export. I just wanted to let everybody know you can export the images of those graphs or the discrete data if you're presenting that or providing reports.
Another question that came up in the chat is what about connection to local healthcare system labs? And again, while we have LabCorp and Quest we've got established integrations with them. We do work with a number of local hospital labs, and that's again something that we could certainly do as an add-on. And we can move very rapidly on those things. It's really going to come down to the capacity of that hospital lab, and are they able? Do they have the resources to devote to working with us to get that set up? But in most cases, most hospital labs are fairly sophisticated. They're using up-to-date interoperability standards, things like LOINC codes, so that could be set up. And especially if the primary focus is around, COVID testing results, that makes it more straightforward. And I will say that we have worked very rapidly, again, over the last 45 to 60 days with a number of clients to put those sorts of things in place. As an example, one of our clients has actually set themselves up as a testing facility. So they're actually doing drive-through testing not only for their own employees but for healthcare workers, and now they're expanding it to the general population at large. As part of that, we've actually set up an interface so that as results come in, we're actually reporting them to the statewide health information exchange in Indiana, and they're using that to help generate, statewide population or statewide metrics on COVID-19 that they can ultimately feed up to the national level. So, like I said before, we're trying to be really agile and flexible here. Conditions on the ground are changing rapidly, and we just all have to be ready to to pivot quickly, based on the needs of our clients and based on how this pandemic unfolds. All right, I'm gonna take a risk here and unmute one more time, and just see if anybody has any questions that they'd like to shout out, and we'll do that right now. Again, everybody's unmuted, so if you don't have a question, please try to mute your phone. But does anybody else have a question or comment?
Hey Jeff, it's Lisa Peckham. I Q&A here from somebody that says, will those emails work with
email address, with Gmail? They'll work great with external email addresses. We don't have any restrictions on that because you're not sending any sensitive information by email, so that's just fine. Okay.
You know what? Again, I want to thank everybody for attending today. We really appreciate your time. And again, if we can be of help, don't hesitate to either reach out to us. We're going to send out a copy of the recording. We're going to send out a copy of our proposal, and then you can respond back to that to one of our sales representatives, or you can send us an email at channel19@enterprisehealth.com. So again, hope all of you stay safe and be well, and thank you again for your time today. Take care.